Greetings from the Africa Mercy here in the port of Tamatave in Madagascar. I'm so happy to be able to greet you. The people of Norway over the years have been such a strong support for Mercy Ships, and I have many close friends myself who have worked together on the ship, and maybe some of you are in the audience. If so, special greetings to you. We are planning to be here in Madagascar for the next 8 months, and we have a full surgical, dental, ophthalmology program planned, as well as our training programs that we'll be involved with. In these recent years, our training programs have increased in size and significance and complexity, and we're looking forward to a very strong interaction with the nurses and doctors and other members of the healthcare community here in this island nation. Surgically, there's a great need here in Madagascar. This nation is number 155 on the Human Development Index. By contrast, Norway is number 1, and I congratulate you for that. What it means to be 155 is that 80% of the population live on less than $2 per day. The healthcare system needs to be improved significantly, and there are lots of other improvements that need to happen for the quality of life for these people to improve to where it should be. So we will be busy with our ophthalmologic surgery. So many people blinded by cataracts. For myself as a maxillofacial surgeon, we'll have lots of patients with tumors, those that have been disfigured with noma, the bacterial infection that destroys the flesh of the face, children born with congenital deformities like cleft lip and palate, others who have been injured and never been able to receive proper care, so they have consequences of broken faces that never were put together properly after injury. As well, our plastic and reconstructive surgery program will be very busy. Burns continue to be a major problem in the developing world. When you don't have the infrastructure working properly, you don't have electricity available, people have to use torches that are powered with fuel, that if it fall over onto the children next to the table, they get badly burned. There's no skin grafts. Their arms and their legs and their necks fill with scar tissue, and they can't move their arms or legs or their neck. Very disabling, as well as other congenital malformations and other things like that. So plastic surgeons will be busy. Orthopedics will be busy. Children with limb deformities, club foot, legs that are bent in the wrong ways, straightening those so the children can go to school, not be teased, be able to move around like everyone else. And then women with fistula, having been damaged in childbirth with obstructed labor, major problem here in Madagascar. It's estimated that there are over 50,000 women with fistula. They cannot hold their urine because of being damaged in childbirth. So our fistula program will be busy, and we look forward to partnering with this nation in years to come to try to address this staggering need. As well, the general surgery will be busy helping men get back to work by fixing hernia, as well as dealing with large toxic or massive goiter. So we'll be busy. The 80-bed ward and the 5 operating rooms and the recovery here on the ship will be full all the time that we're here. Ashore, of course, our dental teams will be working hard. There's a tremendous need for dental care. Dental disease is the most common disease that all humankind suffers, and so to be able to help those who can't access it because of the cost or the unavailability of dentists and those that work with them is very important. So we're looking forward to that. Certainly, in all the years that I've worked with Mercy Ships, I realized the importance of webs of friendship and relationship that cross across this world, and we can work together and do things together that we can never do by ourselves. If that's not one of the great lessons that I've learned from all these years on the ship, that's a big one, is that it's tremendous what we can do together. I want to leave you with a thought that has moved me and motivated me for many years. As I have worked for so long in the developing world, in the low-income nations, I see people who seem to just sit and wait and don't take the action needed to create a better tomorrow. And there's actually a reason for this. They're not lazy, they're not unintelligent. They have all those things, but they lack hope. And you can come into a poor village and you can say, let's work together and see if we can get your water system sorted out, and see if we can get a better school for you and a better hospital, and we can do all these things and tomorrow will be better. And they look back with those sad, kind of apathetic eyes and basically say, what in my life's experience gives me any reason to believe that you're telling me the truth? We have never been helped. We have struggled. We haven't been able to get anything that will ease our suffering. And the quote that has really helped me goes like this: for hope to be credible in the future, it needs to be tangible in the present. For hope to be credible, for hope to be believable in the future, it needs to be tangible, it needs to be experienced in the present. So when people come to the ship and they have their cataracts removed so that they can see, or a child with a terrible facial deformity from Noma gets their face reconstructed so they look like everyone else, or a woman who's been leaking urine for years and years and has been rejected by her family and her community because of the smell and because of the embarrassment, when something practical happens, they think, I thought this was impossible, but it happened. And that gives people the ability to hope for a better tomorrow because they've seen something in their present experience that they thought was impossible and it actually happened. So as we work here in Madagascar and work into the years ahead, I see the ship as a vessel that plants seeds of hope throughout the societies, the tribes, the families that we serve. And the effect of that is not just the benefit that comes to the individual, but I believe this is one of the ways that we will overcome the suffering and the poverty in so many parts of our world today. I thank you for being with us and really appreciate the support and the enthusiasm that you have there in Norway for what is happening with mercy ships here in Africa. Thank you.